I am from Helping Hand MBBS, and today we are going to study the very important topic of ENT, the ear part, that is ASOM, that is acute suppurative otitis media. As you can see here, the acute suppurative otitis media. What does it stands for? That it is a acute condition in which there is a suppuration, that is pus formation is there, and it is otitis media, that is middle ear infection. Middle ear infection is represented by otitis media. So there is pus formation, acute infection, and middle ear infection. Okay, and the general, first we will study the general points of this. In general points, it is the acute infection of middle ear cavity, as I have told you earlier. It is acute infection of middle ear cavity, and you should also remember that the root of the infection is through eustachian tube. Eustachian tube is opens in our nasopharynx. I will show you the diagram. The eustachian tube opens into the nasopharynx and connect the middle ear to the nasopharynx. So the root is through eustachian tube. How the microorganism reaches the middle ear is through eustachian tube. And the infection is from where, is in which part? It is from nasopharynx or oropharynx or nose. Through these three parts it goes to eustachian tube, travels the eustachian tube and reach the middle ear. As you can see in this diagram, this is eustachian tube. Now here there can be a nasopharynx part, nose, nasopharynx or oropharynx. So from this part the infection travels up to the middle ear here. So this is about the how the it travels to the middle ear. Now we should see the next point, and the next point is that the most common microorganism associated with ASOM is Streptococcus pneumoniae. Streptococcus pneumoniae is the most important microorganism causing the ASOM, and the second most common is Haemophilus influenza. It is the second most common organism after the Streptococcus pneumoniae. Now these are the general points, that it is acute infection, reaches the middle ear by the eustachian tube. From the nasopharynx, oropharynx, nose, the microorganism travels to the middle ear. The most common organism is Streptococcus pneumoniae. Now we will see the next part, that is our pathogenesis part. In pathogenesis part there are 4 stages, as you can see here. As you can see here, there are 4 stages, that is stage of tubal occlusion, stage of hyperemia, stage of suppuration, and the stage of resolution. These 4 stages are there, and we will see what are the meaning of this. First you have to see the diagram. Here you see that there in this part there will be the nasopharynx, as I have told you earlier, and the infection, that is strep pneumoniae, travels through this part. It comes and goes along this path. This is very common thing, that when the infection will travel through this part, there will be inflammation of the wall of the eustachian tube, and whenever there is inflammation, there is edema due to the leakage of plasma, and there is hyperemia also. So due to edema or inflammation of the eustachian tube, it get occluded and infection reaches the middle ear, and the part of the eustachian tube get occluded due to edema. So this is the first stage of our ASOM, that is stage of tubal occlusion. Here we can see that it is a stage in which there is edema and the obstruction of eustachian tube due to the infection which travels through the eustachian tube. Now we reach the middle ear and the stage 2 comes, that is stage of hyperemia. Whenever the infections come in this part, whenever the infection come in this part of middle ear or any of the part of middle ear, it will cause the inflammation of the mucosal surface of the middle ear. This is mucosal surface of the middle ear. All of this will get inflamed and get hyperemic. There will be dilation of vessels, and vessel will be very prominent, and there will be congestion also. Also you can see that the tympanic membrane part is also here. It will also get inflamed and hyperemic, and the vessels get dilated in this part. So this is our stage 2, that is stage of hyperemia. In stage of hyperemia, what we see that is inflammation and the congestion of middle ear mucosa, as I have told you, and there is middle ear mucosa congestion and inflammation, and the tympanic membrane also, as we can see in the diagram. And the most important sign seen in this stage is the cartwheel appearance, that is cartwheel sign. The cartwheel sign is present. In what is cartwheel sign? The due to the dilation of the vessels in middle ear, the tympanic membrane part, when we see it through the external ear, the dilation, due to dilation, it appears like a cartwheel. I will show you the photo here. You can appreciate in this photo that the vessels are like this. These are very prominent vessels arranged like this, and this fashion is known as cartwheel appearance. This is cartwheel appearance. You can see very prominent vessels like this. This is due to the hyperemia, due to the infection in the middle ear, which is the stage 2, the stage of hyperemia. This is the cartwheel appearance. It looks like cartwheel. This cartwheel appearance. Now we should go to the stage 3. What happens in stage 3 is that you can see here that in stage 3 there is a pus formation here. In stage 3 the pus formation is there in the middle ear cavity. After the infection, after the inflammation, the pus get formed, that it neutrophil get accumulated due to the inflammation. This is the next stage, that is the stage of suppuration. Suppuration is pus formation, and as I have told you, the name itself told us that it is a acute suppurative otitis media, so the pus formation should be there, and it is a stage 3, that is stage of suppuration. In this stage the pus wait a minute. In this stage there is pus accumulation in middle ear, which cause the bulging of tympanic membrane. It is very obvious that if there is fluid in this, if there is fluid accumulation in this middle ear, it will push the tympanic membrane outside, and there will be bulging of the tympanic membrane. And following the bulging, if we do not treat this condition, it will leads to the rupture of the tympanic membrane. So we should be very conscious and smart to diagnose it very early, so that there is no rupture of tympanic membrane. So in this stage there is pus accumulation in the middle ear and bulging of tympanic membrane, and later it can result in the rupture of perforation if we do not treat it. The main sign in this stage is the lighthouse sign. As there is pus accumulation, it starts to leak out through the external ear here. Wait a minute, let me clear it. As there is pus accumulation in this part, it starts to leak out and it goes to the external ear, and we see the pulsatile release of the pus from the ear. This is called pulsatile otorrhea. And this pulsatile otorrhea in the stage of suppuration is known as the lighthouse sign, which is very important. You should know that there is something called lighthouse sign. Lighthouse sign is nothing else, it is a pulsatile otorrhea, the release of pus in the pulsatile manner from the external ear. Now the last stage is stage of resolution. The stage of resolution is by which occurs in which condition, if we early diagnose this condition and treat it by antibiotics, there will be no infection and there will be resolution of pus and inflammation. So all the above 3 stages get resolved, and it is known as stage of resolution. It is by the antibiotic treatment, the stage of resolution. So we have studied the general points in ASOM, the pathogenesis part, and the cartwheel sign and the lighthouse sign. Now we should come to the management of the acute suppurative otitis media. It is very easy. As we know that it is due to infections, the first thing is antibiotics. We should give the antibiotics to treat the infection, that is streptococcus pneumonia or haemophilus influenzae, or we can give the nasal decongestant. If we give nasal decongestant, it will decongest the our eustachian tube also, and there will be opening and the pus drainage will be through nose instead of the tympanic membrane bulging. So we can give the nasal decongestant. Also as there is pain in the ear, we can give the analgesics also as a management option. Then the fourth thing is very important, that is myringotomy. That is the we make the opening in the tympanic membrane. In myringotomy, what is myringotomy? We make the opening in the tympanic membrane, make opening in tympanic membrane so that the pus drainage can be there, so that pus drainage can be there, and in pus drainage, so that there will be no rupture of the tympanic membrane. The three main things, the three main condition in which we have to do the myringotomy is the red bulging tympanic membrane. It indicates that it is near to the perforation. As it is bulging, it is near to the perforation, so we should make a small incision which causes the drainage of the pus. Another thing is persistent effusion. If after the antibiotics the effusion do not stops, that is the pus coming out from the ear do not stops, it is not a persistent effusion, and we have to do the myringotomy. And the third is facial nerve palsy. As facial nerve run in the fallopian canal of the middle ear cavity, due to the obstruction and the pus accumulation, there is pressure on this fallopian cavity, fallopian canal, and there is facial nerve palsy. So we have to do the incision so that the pus comes out and the pressure is relieved, so that the facial nerve remains normal. And the last and most important thing is curvilinear incision is given in posterior inferior quadrant. That is how do we do this myringotomy, how, in which part we have to make the incision, and in it should be of what shape. So we can see here that it is a curvilinear incision, that is J shaped incision is given in the posterior inferior. There are four quadrants. This is these two are anterior, these two are posterior, and the posterior inferior quadrant, in posterior inferior quadrant we give the curvilinear incision. So this is the management part of the ASOM. We have studied the complete ASOM in three parts, that is general point, pathogenesis, and the management. So guys, if you enjoyed this video, please like the video and subscribe our channel, and wait for the other videos like CSOM and unsafe